So my name is Chen. I consider myself a Bay Area native. I grew up in Fremont, and I'm a genetic counselor. And technically, I guess my title is perinatal genetic counselor. So I focus on patients who are pregnant or thinking about pregnancy.
And as a genetic counselor, are there subdisciplines? Are there genetic counselors who focus on sort of the non-perinatal aspect?
Certainly. So this profession is still pretty new. I think in the beginning there weren't that many specialties. It was either pediatrics, children, and prenatal was the second, I think, as soon as pregnancy tests started. And since then, there are several different specialties. The big ones are pediatrics, prenatal, cancer has become the hot new thing. Counselors who work in the laboratory, and then specialty counselors who work in certain disciplines like cardiology or neurology.
Nice. And what kind of training was involved? So once you figured out that that's something you wanted, what do you do to become a genetic counselor officially?
So it's very specific. So it's usually a 2 or 3 year master's program, specifically in genetic counseling. So all the courses are geared towards the science of genetics and counseling theory. And so right now, I just did the stats, I think there are about 30 programs nationwide. So there are 3 in California and then in other states. And so you still have to apply, take standard testing like GREs, they're still around, and do some training like volunteering in healthcare settings. So I volunteered at Planned Parenthood for a year.
I see.
Doing the pregnancy tests.
Cool.
And then applied.
What are the various backgrounds? Do all genetic counselors have the same academic training, or do they have diverse academic training?
So counselors come from a wide variety of backgrounds. They do have in common that they have to have a master's degree, and the master's degree programs require an undergraduate, usually 4-year college, and some prerequisite science courses, biology, chemistry. But other than that, you can be any major. So my classmate was a psychology major, I was a genetics major. Some people were completely not related to either specialty as long as they finished their courses.
What do you think about the profession itself overall? Is it a profession that's growing in number, and how is it growing if it is?
So yeah, the profession itself definitely is growing in number. I don't have year by year, but I think in the very beginning, I think the first National Society started in the late 70s, and then there were probably 10 to 30 members maybe, and now I think we're up to past 2,000 nationwide.
Oh, wow. Yeah.
In the state, I'm organizing this conference coming up, so I just did some stats. In this state, there's probably about 400 licensed genetic counselors. So just to give a perspective of, we're still a small specialty, but definitely growing.
I guess this is sort of more of the personal side, but I mean, do you like being a genetic counselor? Do you feel like you're helping people? What aspect of doing this job is probably the best and most fulfilling for you?
I think it's a combination of things. Like this job, definitely, I really enjoy being a genetic counselor. It really fits my niche, that it combines my interest and my love of science, and specifically genetics and genetic conditions, with seeing patients, helping people in a healthcare setting. So I've been thinking about some of these answers that, the traditional role for a healthcare professional is a doctor. But doctors have a lot of stress, a lot of schooling, doing treatments and procedures, and I wasn't necessarily interested in that part. I was really more interested in communicating to patients and feeling like I could help them just using my words or just being there for them and listening to them. So I really feel that this profession has been a really good fit for me and my personality. So a lot of what I do is, I think of it as a consultation, but also just providing information. I see us as a link between physicians and patients, that traditionally doctors order tests that are fairly straightforward, like a blood count or a blood type or something like that. And they can easily tell a patient what that means in a sentence. With this genetic testing, it's much more complicated than that. It's not always a straightforward yes or no, and doctors don't have time to spend with patients explaining that. And so I see us as a bridge between that, being able to help patients decipher and interpret this information, and then also helping them make decisions based on those results. Because a lot of decisions to be made, especially in pregnancy, are not always medical decisions. They're personal decisions about what patients want to do, about information about their future offspring. So prenatal specifically is an interesting ethical realm, because we're also dealing with pregnancy and termination.
You do pedigrees, don't you?
Yes, we do. We always do pedigrees. It's kind of our shorthand
Okay.
for gathering medical
Are
information.
you fast? Are you good? How fast can you like draw a pedigree?
I'm pretty, people, my colleagues would say I'm too fast at a lot of things, so I'm pretty fast at drawing a pedigree. We have colleagues that don't have the template, they used to have a template that you could trace a pedigree.
gosh.
And so I had colleagues who could whip out that template and do the rotation and things. But most of us can draw freehand pretty well. But now there are programs that also draw pedigrees. Because mine are fairly basic. I could take maybe 3 generations of pedigrees. So patients, their children, and their parents. Some pedigrees, like for cancer, where you're really trying to pinpoint all the individuals with cancer, those pedigrees could get huge. And then I think the counselors definitely need help with a program that can kind of line things up and sort things out.
Have you ever had to look at a trait? Or, I don't know, I'm just curious. Have you ever looked at a trait where no one knows what the inheritance pattern is yet? Like, have you ever discovered a new inheritance pattern? Like, does that happen as a genetic counselor? Are you ever looking at traits that no one's ever described before?
So that's kind of 2 separate questions. So that looking at a pedigree, sometimes we don't know the inheritance. Like, it doesn't fit a traditional dominant or doesn't fit a traditional recessive. So that's kind of the fun part of our job, where it's a rare occurrence of something happening. So it's not, I don't think we've discovered a new inheritance, but we've discovered new instances of it, rare instances of things that can happen with traditional inheritance patterns. So that's one way, like something happens on top of something else, and that's what gives that pattern. And then we can also be fooled when people are related to each other, because then that throws things, because it could be a dominant trait, but if there's relatives that are related to each other, it could be recessive as well. And then your other question just about, I mean, we certainly have conditions that nobody's described before. And we see it in prenatal, but we see it more in pediatrics, where a child comes to us with a unique set of symptoms, and that's not been described. And so that's a cool part of a pediatric genetics counselor or doctor's job, is they might actually identify a new syndrome. So I haven't personally been part of that, but my colleagues actually have. And we know physicians who have discovered new conditions and have had them named after them.
Wow.
Yeah.
That's crazy. That's pretty cool. There's somebody watching right now who's really interested and wants to learn more about being a genetic counselor. Do you have any particular good resource you would tell them to go visit, or do you have any special message you would tell them about genetic counseling?
So yeah, I would highly recommend the profession if anyone's thinking about genetic counseling. It's a very good combination of medicine and healthcare and interacting with patients. So we call that a clinical kind of job. If you like patients, and if you like the specific field of genetics, because that's pretty much what we're talking about. So if you don't like genetics, I wouldn't recommend this profession. But if you want to work with people but still be in tune with the science, it's a really good profession. There are a lot of counselors who work part-time, and we don't take call like physicians or nurses. And so for those, again, who want to go into medicine but don't want the extra stress of those kinds of things, it's a really nice profession. Lots of counselors work part-time. Again, because we're seeing patients and they can be scheduled appointments. The salaries, I think, especially with our certification and licensure, hopefully are starting to increase, and there's certainly a lot of job opportunity. So I would highly recommend checking out the website and talking to a genetic counselor if you can, even shadowing a counselor, and doing some volunteer work in healthcare, just to make sure that's the area that they like to be in.
Great. That sounds like great advice. Thank you so much.
Thank you very much for the opportunity.